Ligman. I'm a co-founder of Jota. It's a pleasure to be here one more time to have an in-depth discussion about the social, institutional, and corporate challenges to fight the COVID-19 pandemic in Brazil and in the world. This webinar that will be conducted in English, as you already noticed, is a part of a series of events organized by Jota and INSPER Center of Management and Public Policy. INSPER is one of the most respected educational institutions in Brazil for its quality in several areas, such as administration, engineering, economics, law, public policy, and communication. With the partnership, we from Jota believe to be closer to our mission to contribute to a more predictable institutional environment in Brazil. Today, we'll have a pleasure to learn from Verónica Osorio Calderon. Verónica is an economist from the Universidad Católica Boliviana, São Paulo, with studies in public health at the EHESP Sorbonne, Paris, France, and in social policy and social research from the Institute of Education, University College London, England, and a specialization in reproductive health services programs from the Institute of Tropical Medicine in Antwerp. Her research is focused on health economics and social policies in different countries of Latin America, Caribbean, and Africa. Her studies and projects focus on different epidemics such as HIV/AIDS, sexual and reproductive health, and on health emergencies such as the cholera in Haiti, Zika in the Americas, and Ebola in West Africa. She worked as a consultant in different international institutions like World Bank, IDB, and the United Nations. Verónica Osorio is currently part of the Scientific Council of Advisor of COVID-19 of the President of the Plurinational State of Bolivia. The subject of our discussion is very interesting. We'll talk about how governments and policymakers should organize a management crisis and communication strategy in a situation like that. She will share with us a really interesting framework about this. I'll now invite the Professor Verónica to start her presentation, and then we can discuss practical good and bad examples and also answer some questions from our subscribers, students, and guests. Thank you so much for being here today with us, Professor Verónica. Please, you can start.
Thank you very much, and thank you so much for the invitation. It's an honor to be here. I will share my screen to prepare the presentation. Okay, can you see it? Yes. Okay. So, well, thank you very much once more. I am very glad to be here and sharing with you this presentation that I prepared. This is about crisis management on COVID-19. It's focused on the rapid response and the communication of data that the policymakers should make. So it will be very interesting to know about the different reactions that you have in all the regions that you are right now. Before starting, I would like to invite you to download this app or go into the web page if you are in your computers, so we can make an interaction while I am doing the presentation. This is the user number, so you will connect to my presentation. So while you are doing all that, I would like to explain you about the background of this presentation. This is a part of a guideline that we prepared, me as a Bloomsbury Policy Group with Asuntos del Sur to help somehow to decision makers how to confront the COVID-19 on their municipalities, on their communities, or I don't know, their cities. We created this by the end of March, mid-March, end of March, and we published it on the beginning of April. And the situation has changed a lot in the region by now. By then we were a bit confused. That we were listening different messages with different information, and we were thinking like how we from our houses, from our quarantine, can help. And we joined knowledge backgrounds, and we created this guide that had a lot of success regionally. It was translated to Portuguese also, so we can share it later. And well, yeah, it was shared in different governments, at local level, national level. And now what I tried to do was to update it a bit to the situation right now, and to present you the proposal that we have. Well, I hope you already are in the poll everywhere. We will see. Okay. Going to the poll, if you can answer, please, the word, the question, what word comes to your mind when we say COVID-19? Okay, disease is one, so you can answer everything you come for, like, we'll see. Fear, okay, that's interesting. Let's wait for some answer. Death, okay. Disease, okay, again, disease. Let's see. Some other answer. Let's wait a bit. We'll see if this work. I hope. Pandemic, okay. Change. Oh, that's a very positive message. Apocalypse. Wow, that's. Crisis. Okay, let's wait 30 seconds more and we will close the poll. Normal, death. Very interesting. Okay, so new, okay. Okay, so we will keep with these answers. I see a lot of death, fear. That is the most frequent word, and it's showing kind of, yeah, more death is getting bigger. Suffering, yeah. Yeah, this is very interesting to see. Actually, it is. If we make the same exercise later, we will see how is the message that people are receiving. Anxiety, yeah, exactly. So yeah, this shows how is actually the people feeling right now. No, we will finish the survey. If you have to say something else, it's now or never. Okay, let's go. Next. Well, the COVID-19 is not just a virus, it's bringing a lot of crisis and fear and, well, actually death also. But it's a situation of an instability. We see it's an environment of insecurity at all levels. This is bringing panic in the society and leading to and a big economic crisis. We have seen in all levels already with the record lower prices of oil, for example, that has come as a consequence of all the instability in the economy and the well, decisions that are taken by the governments and industries that are leading to also a high levels of unemployment. It is predicted that it will be a crisis that is even bigger than in the 1930s. So we can expect higher levels of unemployment, especially in our region with high levels of informal labor market. So this also can bring political crisis, and it is expected to have social disturbs if it is not now, in the near future. So it is a chaos right now, but also we can have, well, we expect to have food insecurity, leading also to, we say, undernutrition levels that we have already passed few years ago, and it was actually a big effort from all the countries. There are some estimations that says that the level of poverty will reach, well, we go back 30 years that we have already working or in our region. And so all of this mixed with some human rights crisis, there are some excesses that are taken by governments in the name of COVID-19, and others that are not named as excess, like the liberties, the limitation of liberty, like circulation, transport, traveling, all of that that are against the measures recommended for COVID-19. But other social problems like gender inequality, we have seen not only the frequent gender inequality subjects that are talked about, like in the labor market, like I don't know, in the healthcare access, but also the worrying increase of gender violence inside homes. So it's a big problem that this little virus is bringing to our countries and societies. Also, not to forget the health system saturation that is not only related to COVID-19 and all this pandemic, but also to other diseases that in our region, like tuberculosis, we have dengue also in some countries, maternal mortality, all the teen pregnancies that is very characteristic of our region, STIs, HIV, well, and the polypox that has come back, and the vaccination strategies that are limited with the COVID-19. So it has a lot of consequences. This COVID-19 is not a very easy topic. And we already know that we cannot escape. All the planet is affected already. Our region also, we can see it here. Latin America, especially Brazil, Ecuador has the highest rates on the fatality and new cases. So even if in your community or city you don't have a lot of incidents, you will have it sooner or later. We expect that, and you have to expect that. So what is going on? Right now, this is a crisis, and decision makers have to take fast decisions. From one day to another, the situation is changing. Sometimes there are outbreaks somewhere, we don't have capacities, we don't have governance, and they have to take fast decisions. But also they have to be sustainable, because even if we are in a period of crisis, or that is supposed to be from some period of time, it's very difficult that these measures that are taken right now, they will change. So they have to be sustainable in order to have it useful and I don't know, helpful for our population even after COVID-19. And also they have to be equitable, leaving no one behind. This was, well, this is quite difficult, because when taking some policy right now, they are trying to focus on the most vulnerable population, but they are always a error of exclusion and inclusion. And so it's quite complicated to measure which is the best error, or to decrease at the lowest level this kind of error for inclusion or exclusion. But and also they have to be accountable. There is a lot of risk, well, a very high risk of corruption in all the measures that are taken right now. For example, the governments have to buy large quantities of equipment, of testing, and to move people around. The human resources have to be taken into account. How is the industry, which industry is going to be benefit the most, and all these kind of things can lead to corruption. And we know already that our region has the highest levels of corruption in the world. So we have to be to be accountable, no, when they are taking decision makers. Now we are all this pandemic took us in the worst moment of political environment in our region. So as part of our guideline that we proposed, that I was telling you, we proposed well, a management of crisis and a communication, good communication to the population, from the decision makers to the population. And we proposed specifically 4 stages of this management that are based on the Harvard University study that they done on March. And the first one is to assess where your city is right now in all the pandemic. Maybe you already are in a, well, by then it was at the beginning, everybody was starting, but right now at local level, that as it is the main proposal, is to see where you are. If you are surrounded by municipalities that are in high risk, if you don't have cases, if you are increasing cases, or you have already a lot of cases and it is unsustainable, or well, which is the part in the curve of the pandemic that you are. And in this situation, in this assessment that you have to do, is your using the epidemiological indicators to see protection, prevention, crisis response, recovery, resilience, these 6 measures that are related to, for example, prepare your indicators, prepare your hospitals, prevent, in the terms of prevention, it is related to, for example, communication to the population about prevention measures, keeping physical distance, washing hands, avoid crowded places, avoid going to work if you don't need to, and do work at home, but all these kind of prevention measures, and to prepare also the personal and the health system, managing the crisis if it is already here, already there, your what you have to do if you are going to implement strong quarantine, or you would be a bit flexible according to what indicators, or the deployment of human resources in all the region that we are managing, and also you do a priority setting in terms of policy making. If also if you are in well, the response is also related to that, and if it is in recovering, how you are gonna go back to the new normal, which is which measures are gonna stay, and also the resilience that comes after the recovery stage. Well, this is the first one. The second one is related to create a team. Well, if you are a governor, if you are a political person working in the government, you don't need to know, you don't have to know about COVID-19. And even if you are working, like you are a boss or the CEO of an industry, you don't have to know about the COVID-19, but you can be surrounded by people who know about it and who can give you advice. A good example of this is, for example, the governor of New York, Andrew Cuomo, who is surrounded by the best scientific team in the United States, and they are using a lot of data, and they have a narrative about the data. It's not only about collecting, but also doing the narrative and explaining to people exactly with the truth, and doing presentations and showing graphs and all that. If you see one presentation of Governor Cuomo, I really recommend it. It's a big, a good advice of what it is to have a good team and a management of data. And also this team has to be with different backgrounds, professional backgrounds, and showing somehow diversity that represent the society, you know, related to gender, to race, to I don't know, income, I don't know, according to what is the population or society that you are dealing with. And also to have some skills for dialogue and agreement and coherence with the values of and goals that you as policymaker you have. No? And this is a key part of the management of crisis. So because they have a more technical point of view and not so political, and they can manage all different kind of points of view. And also determine a process of how the problem solving will be. No, we recommend 6 stages and 5 actions regarding to the stages. First, establish the objectives and priorities, which is the first thing that everybody does, I think. Understand the situation with an analysis of the data and the narrative that I was saying before, develop options according to that, and use projections and scenarios. For example, well, even in New Zealand, the government of New Zealand has developed that. UK also did it, a very good examples. Also New York that I was saying before. They developed the worst scenario, the current scenario, and the worst scenario, and where they are going. So they show somehow a bit of control in the management of the crisis. Take decisions, and in this case, it means by executive orders and task distribution, who is going to take which decision in terms of what subject, and execution of these decisions. This is it has to be very clear for all policymakers, or all the people who are involved in this management of crisis, and also for the population, for the accountability that we were talking about. And also identification and management of political risks. We don't want some unnecessary problems that are related to political issues in a public health emergency. So we need good leadership. Community participation is key, especially for the delivery of the message that we want to bring. And the civil society participation, of course, is always important in policy making. And a strong communication strategy. Well, in Latin America, we have also seen some countries that are avoiding the subject, like the COVID-19 is not a big crisis, which we know already that is not like somehow like that. Also, some countries are not reporting cases, not because of they don't have the capacity, but because they don't want to. They don't want to scare people, but it's not like that. We propose rather than a fear message, an alert message, no more positive, and the people need to know what's going to happen and what they need to know. So going into the public health point of view, so we can mix all the message that we were trying to give you. We are looking at it, for example, the number of cases, it is increasing. Brazil is the only country in Latin America which is among the most affected countries. We see it here is this little line, purple, I think, which is increasing just before United States by May 11. So it's quite worrying. The community case, we can see here how it increased. No? Also, we see that the case fatality ratio of Brazil is also here, and there is here there are the high-income countries. But we see here.
Oh, excuse me, Professor. The microphone, I think, is having some issues. Maybe if you can just, yeah, perfect.
Okay, better?
That was so much better.
Okay,
yeah.
Thank you. Yeah, so we are looking at here that in these countries with elderly population,
no. Again is fading. I'm not sure what's going on. Maybe
now.
Yes.
Okay, I won't move my hand now.
Okay. Sorry about that.
No, it's okay. Yeah, well, we are looking here that the fatality rate, the case fatality ratio is bigger in countries where they have a higher proportion of elderly population, and here we can see the difference in countries. But Brazil is still the only Latin American country here among the most affected countries. Why are we looking at these indicators? Because the main objective from the point of view of public health is to avoid a saturation or oversaturation of the health system and to prevent deaths. No, that's the main objective. We don't want people dying because of COVID-19, and we don't want panic and all the consequences that have a saturation of the health system. So there are some interventions that are mainly done by most of the countries, which are related to diagnosis, isolation, contact tracing, and hospitalization. These interventions are trying to get, well, they are focusing more on this. So countries are creating capacities like testing strategy, more fast testing, infrastructure for isolation. Some of countries are establishing hotels for isolation of mild symptomatic cases, and also in contact tracing, which is the most important, I would say, strategy. They are capacitating new human resources. They are hiring people to do the contact tracing, which is it's like a inspector job. You have to detect which are the cases that a positive COVID case had, or which places they have been exposed. And in terms of hospitalization, all the UCI, beds in hospitals, oxygen machines, and human resources that are specialized in this kind of health services, also in nursing. No? So all these interventions and capacities are mainly created in the quarantine. That's actually the quarantine that works for the, and most of the countries has go into a strong quarantine according, well, mainly the low and middle income countries, because they don't have these capacities, no? And quarantine is a period of time to buy time to develop the capacities while everybody is locked and nobody's moving, and we can develop interventions in a better situation. So there are three lines of actions in this sense: prevention at individual and collective level, which represents all the measures that are basic, let's say, hand washing, the infection, physical distancing, what else, use of mask, all these kind of things. And collective, which is the closure of schools, of borders. Well, we already know this kind of prevention measures. Detection, which is related directly to testing, and response, which is how the countries are creating the response. No, so like let's say protocols, guides, and plans that are developing dual health systems, which is not actually installed, let's say, because it's when it's the capacity of the health system to detect if you are a positive or negative case, and according to that result, give you a different treatment in the health system. Biosecurity in the first line workers, not only related to healthcare system, but also to guard, security, and the essential services, isolation shelters, and the hospital capacity that we talk about. And all of this is related and is comprehensive with a communication strategy using the data. So, well, this data has to be generated, of course, and contact tracing. With the contact tracing, the identification of cases, and the statistical capacities that right now we have available many apps and technology that countries are using, and even not at national level, but also at a regional level, to generate this data and to know a bit more what to do. And this data has, but that is only that I am mentioning here, are epidemiologic. They have to be compared also to the economic data, because each region has different situation, and also to the social data. For example, in our countries in the region, especially Brazil, I would say we have a lot of how you say, I forgot the word in English, when the people is concentrated in a country. Maybe Felipe,
agglomeration, maybe. Oh.
Yes. No, but they are like, there are a lot, like 3 people living in one room.
Yes, this is a huge problem in Brazil and in other countries in Latin America. Yeah.
Yes. So
density, population density.
Density population. Yes, exactly. So we have all these data that are very social, let's say, that, and also access to clean water hygiene and sanitation, that in some regions we don't have it yet, and which are very determinant. So what is here? Well, I will refer to Andrew Cuomo, that it's my example on leadership right now, that he is saying, look at the data, follow the science, listen to the experts, and be smart. So data is the key to how you communicate this data with transparency and let's say honesty, so people can know what to expect and what to do by themselves, not controlling, not to be because of the control that governments are making. We can go out from this big crisis in a better way. So we will go to the next poll just to conclude. We'll see. I would like you to tell me how what do you think about this crisis? It is a high risk, medium risk, low risk, or no risk right now in your situation? What do you think right now? Well, let's wait for more answers. Don't be scared. Let's wait for more answers. I think the YouTube is a bit delayed.
Yes.
Okay.
Probably people are opening the app again, so we need to wait.
Yeah. Okay. Well, let's wait for a bit more. Well, I'm glad that nobody thinks that there is no risk. Because it's something we have to take some measures right now, and it is actually we are depending practically on the leadership of our governors in each region. But I truly believe that from our position as community, now in our community, we can have some impact. Okay. Okay, well, let's give 30 seconds. Okay, well, this is the main conclusion that I wanted to have it with you in interaction with you, that this is a very high risk crisis. It is affecting in all levels to our governance and governments. Well, thank you very much.
Perfect. It was amazing. I think it's very nice to see how we should deal with that. And of course, it rings a bell, a lot of things you said on how things are being conducted in places like Brazil and other countries and all. We don't need to say that we have not only a health problem and crisis in Brazil, of course, that will have economical consequences, but also a political crisis right now, and probably because maybe the people in charge in Brazil are not applying this framework you are basically suggesting to apply. So good communication, data and science, and trying to not, of course, not create a panic, but alert messages. I would like to ask you, so we can start this discussion. First of all, you are in Bolivia, right? I'm in Colombia, so I'm following all the instructions of President Ivan Duque, and we have here a situation very different than Brazil. So in Colombia, for instance, we had a mandatory lockdown that started since the beginning, so there was almost no cases here, and we are not allowed to leave home. Now they are starting to open some to open some exceptions and so on, but you were not allowed to go home. The schools were closed. If you go home, you can get a fine and pay a pretty expensive one. The president Ivan Duque goes every day in television. He every day at 6 p.m. he goes in television with his experts and basically do more or less what you said that Andrew Cuomo from New York is doing. First of all, I would like to, and we know that in Brazil, basically, we have a different situation. We don't have mandatory lockdowns. We don't have a national strategy that is very radical. It's actually a little bit, what is going on in Brazil is part because of the action of municipalities and governments and so on. How about Bolivia? And how can you compare the regions? So we have Argentina, we have Peru, we have Ecuador. It's a very different situation in each country. I would like you to start talking a little bit about Bolivia, and then talk about the comparison of other countries as well.
Yes. Well, thank you for the question. I think Brazil is an special case, is an outlier in all the trends in policy making in the region. No, the thing I think they are betting that they have a bet on the herd immunity, which is that almost everybody will get the disease at some point, and they will create an immunity in their own bodies. So at some point, the disease will disappear by itself. This is actually the case in this kind of virus. But while this happens, we have other things happening. No, when you get a complicated situation, which is the 20% of all cases, you have to go. You need to go to the hospital, and that's the problem. When you go, if the 20% of all the population are demanding the services of healthcare systems, you have a oversaturation, and you cannot control. And actually, you cannot. Yeah, the health system can bankrupt practically. And that point of view is considered in the other countries of the region, and I think it's a trend at global level, no, in all the world. And but the quarantines in a situation where the economic is mostly informal, that means that people has to work every day to receive a payment to live the same day, and also where there is no contract in the contract, no, in your job, for example, or in a, well, you won't receive, you are not secure, you don't have an income secured by the end of the month. Of course, you cannot keep a quarantine as was kept in Europe, no? In Europe, they had the luxury to have a longer quarantine. And in Bolivia, that was actually the situation. We have the economy doesn't allow us to keep a quarantine at the national level. And we have seen that at national level, not all the region, not all the territory had cases. So some of them were on quarantine, while the main urban sectors were having the problems, no? So, and I think that was the main observation in all countries, and that's how the government decided to open it according to epidemiologic and economic indicators, no? That was the case of Argentina, Colombia, Paraguay, I've seen also, and Bolivia, that as far as I know, no, they call it the smart quarantine, the dynamic quarantine. They had many names, but the logic is the same, to open the strategic sectors of the economy that are providing mainly the more work to people, and also opening some kind of liberties that were restricted before, like transport, circulation. But at the same time, they are still keeping some measures of the quarantine, like lockdown and working at home and all these kind of things. It's the most, let's say, it's not, there is no a rule, because the virus is quite new. It's from December, and we don't know like which is the gold standard measure to implement. But we have to experiment right now. It's something like by mistake. We learn by mistake, and we will keep learning from it.
Yeah, before we start, we were talking here, and I asked you why Bolivia has so few cases. So if you analyze it, less than 150 cases, and you gave me an interesting answer. Can you answer it again, please?
Yes, it's a meme that I have seen, and it's very true, which is like how many cases you have, one, and how many tests you have done, one also. So if you don't have a testing, a high number of testing, you cannot know actually what's going on, in the country or in the region. But at the same time, you have to measure what's the capacity that you have to do massive testing. We don't have the capacity to do as South Korea or Germany, that they have done a lot of testing. Chile has done also, like I think 2,000 tests per day. And well, we don't have that. We don't have the number of laboratories. We don't have the number of people trained to do testing. So there are things that are far off our reality right now. So we have to adequate our measures according to what we have.
Yes, a question that is arriving here for me is basically you use an example, Andrew Cuomo, and maybe UK as a good example of communication. Can you give us other examples of good communicators in this moment, or and trying to somehow link with your framework, so what they are doing that are right and what things that they should avoid doing? So we should maybe go a little bit deeper of the good communication skills that a leader should have in this moment.
Well, two of my favorites are Jacinda Ardern from New Zealand, and also Angela Merkel. Angela Merkel, for example, I love the conference that she gave, where she explained in a very easy words what's the transmission rate. Transmission rate is not so complicated. An indicator that is used in epidemiology. It's not so complicated to explain, but all the background is not that well, it's somebody who has the knowledge of mathematics and programming can do it, but it's not, well, it's something like that. It's a model that you have to estimate. But she explained it so well that you actually believe her. Even if she wasn't wrong, you believe her. She was very confident, and she was explaining in these terms. She's not an epidemiologist, but she knows what she's talking about, and she's always giving numbers, giving tests, saying, okay, we can expect a second outbreak, we have to take care. They are giving the exact words of what the people needs to know. Also, Jacinda Ardern has, well, the situation of New Zealand is quite exceptional, because it's a country that is an island, so they can control the borders quite well, better than us, for example. And she managed a very good strategy of communication based on 4 levels of risk, that are according to what the World Health Organization also established. So people, and before that also, the approval of Jacinda Ardern was quite high, even at national and international level also. So she can, she has some, she is very empowered on their message that they are giving. So whatever she says, people believe her. So here it comes the leadership that we are expecting. No, well, in that sense, well, I wouldn't. Well, she since the beginning they established lockdowns and they established some measures that are kept until now, and the people are compromised with these measures. They are using as their own. They are the narrative is the population is taking the narrative as their own. So that's the most important thing, that you are taking care of yourself, that you are washing your hands every time you can, because you are aware that you can get the disease, and you don't have to do that because you are not only on the risk of dying, but also to give all your family and your beloved. So these messages are quite well. These two leaders, I would say, that I love the most, and I try to follow them how they are doing. Cuomo, what I like the most is that they, for example, every time that he presents a message, he is following all the biosecurity measures. No, that is not doing here, for example. No, they are his team is with distance. The journalists are in a distance among them and with them. So these kind of details are, of course, very important. And and he also used graphs. He used he's getting very personal in each interview that he takes. He talks about mental health. He talks about the vulnerable population of people living in a street situation. So he is very human, more human there. And this what I like the most about them.
And there's here another question that I think is the opposite. So what is, can you give us examples of worst practice and maybe what you should avoid when communicating as being a public leader? So of course we are in Brazil, so it's interesting to analyze our current president, but no, we don't need to be restricted to analyze Bolsonaro, but also we can talk a little bit of what you should avoid doing during a time like this and when communicating to the population.
Well, I would say that giving a wrong impression that giving this wrong impression of security, no? That happened, for example, in Venezuela. We know already that the health system is totally broken in Venezuela. So with this crisis, the president comes and says, "Oh, we have everything under control." How is that even possible? And giving security to the population that everything is under control, even if you don't know, it puts them at risk. No, they say, okay, if everything is under control, I don't need to follow all the measures that are telling me to do. I don't need to keep distance and all that. And that's the wrong impression that you can have, and that also saying that this is just a flu and what can I do about it? No, it's this kind of messages. Of course, you can do a lot of things. We have seen already, I presented you that building capacities are also not only for this COVID-19, but also for future epidemics that will come, and we are ready about that. No, that other crises will come, maybe not, let's hope they don't bring us in this situation that we were now. Actually, a good example of that is Africa compared to Latin America. For example, Africa was already prepared, well, not, let's say, 100% prepared, but they already established some measures, for example, of the response, no, in case of an epidemic, because they already have other diseases, they already have other epidemics. So a COVID-19 with HIV, with malaria, with Ebola, it's the worst scenario that you can expect in the world. So they already were prepared for a kind of pandemic, and the health system somehow responded better than in our region. And I think we were not prepared. our governments undermined the risk of a pandemic that were always, the World Health Organization was always saying, prepare to a pandemic, prepare for a pandemic, and the pandemic expected was a respiratory disease. So we knew already that this could happen and we didn't take it seriously. And the fact that some governors or presidents are taking this as a simple flu is not it's not adequate. No, we are seeing some consequences also in the United States, that people are protesting against the lockdowns measures and the COVID-19 measures that are against their liberties. But we don't need that right now. No, we need to have a discipline in the population, and this is not only for this COVID-19. This will create some behavior sustainable in time for future threats.
Perfect. Yeah. So I think we are coming to an end. So I'm gonna give you a less opportunity to say final words, but also I would like to ask the final question, which is, how do you think is the correlation of applying those management crisis strategies and communication strategy will be with the economical recovery at the end? How fast can a country, there's any relation between fast economical recovery and the ability of deal with the crisis in a best way? So if a president is not doing his job or her job, and on the other hand, another president is doing his job or her job, can we expect that they will have different outcomes after the crisis? And with this question, I just give you the floor for the final words. Thank you so much.
You.
It's a pleasure having you here.
Thank you, Felipe. Well, yes, of course, because with this management of crisis, you have you create confidence in your leader, and it creates leaderships. We have seen some leaders that came up thanks to COVID-19, like the president of Peru, who was not elected, is not an elected president, but his rate of approval increased a lot. And we know that the economy is based on the expectatives. No, if you know that the country is gonna be led by some president who knows what he's doing, who is based on data, who created reliable and sustainable systems during the crisis and created some environment of confidence, you can expect that the economy, based on this expectative that were created, would recover easier. It won't be easy, no? But it will create some fluency, let's say, on the measures that will be implemented, that will be very strong. Now we expect that after this, we will have some recovery policies that will affect us all in general, no? And also what happens in Brazil affects to Bolivia, affects to Argentina. So we need to have maybe even a coordinated response to create some expectations of confidence and trust on our government. And this is the opportunity, I would say, also because this kind of situation of crisis increase and enhance the inequalities in the population. We would see that gender inequalities will increase, income inequalities, education inequalities this gap will increase. So we need to have policymakers, governors, and presidents who are considering these aspects of the society. No, I hope, well, to finish finishing words, saying that even if we are not specifically on the level that we can make decisions to influence the way of our country is going, we can have some actions at community level, we can have actions at individual level if we are conscious and also aware of what is going on. We need to be as expectant of how the epidemic is going around us, how we can prevent some things, and how we can avoid exposure of ourselves and our beloveds. So we can do some things at individual level, and also if you want to go further, you can join efforts. Right, as you have seen, this epidemic will affect in all aspects to many subjects, many sectors in our society. So you can have something to do to improve the situation in your environment, in your region, wherever you are. So there is hope, and I think we can keep with the positive messages that is a period of change, but in a positive way, and that's up to us.
Yes, let's hope that this new normal is a better normal, right?
Yes, it's a better normal.
Thank you so much for being here. I would like to thank our audience, subscribers, guests, and students from INSPER. Now I switch for Portuguese, apenas para dizer que a gente continua a nossa série de webinar essa tarde com o Fábio Zambelli, que vai receber, só um minuto, o Guilherme Afife e o Vander Giordano. Voltamos com mais informações e com as nossas séries de webinar diariamente no Jota. Muito obrigado a todos, um grande abraço e até a próxima. Tchau, tchau.
Obrigado.